Welcome to the Joe Cohen Show. Join me as I share my experience with biohacking and invite top health experts to explore the latest technology, supplements, research, and resources for optimizing your body and brain. Hey everyone, I'm here with Dr. Chris Shade. He's the founder and CEO of Quicksilver Scientific, which specializes in the biological, environmental, and analytical chemistry of mercury in all its forms and their interactions with sulfur compounds, particularly glutathione and its enzyme system. He has patented a mercury speciation diagnostic process to analyze toxicity, found one of the only clinical labs in the world to offer mercury speciation analysis, and has designed cutting-edge nutraceuticals for detoxification and antioxidant protection. This includes advanced phospholipid delivery systems for both water and fat-soluble compounds. He's regularly sought after to be a speaker, educator on topics like mercury, environmental toxicities, neuroinflammation, immune dysregulation, and the immune system detoxification. I have him on here to talk about, there's a bunch of stuff I want to know about liposomes and which supplements need to be in liposomes and the different kind of liposomes. So hopefully we could get a better understanding of all that stuff. Thanks for coming on.
Oh, happy to be here, Joe.
All right. So first of all, how did you get into this stuff?
Yeah, good question. I had a very long, circuitous route to even getting into healthcare. I used to be an organic farmer. So I was always into how do you get the natural system working better, and whether it's soil microbiome or the human one. I eventually did a PhD. I joked that I went out of business in organic farming the year Whole Foods was formed. It was a little early. And then I got a PhD in environmental mercury chemistry and developed all this testing for it. And then when I started to commercialize the testing, I realized the solutions that we had for detoxification were really bad. It was all these pharmaceutical chelators, and they were really rough on the body. And I started looking at how do you make the body really move these toxins out. And first I made this specialized binder called IMD that picks up all the mercury that gets down out of your liver into the GI, and it made it a safer route than going through the kidneys with the chelators. And then as I got to understanding all the chemistry in detoxification, I realized I needed glutathione in the body. And to this day, that's our flagship product. But how do you get glutathione in when it's this tripeptide that breaks down in the gut? And that led me to liposomes. And liposomes are these little nano-sized spheres that will entrap a molecule, a nutrient, and if you make it right, it absorbs right through your oral cavities. You swallow it, it's absorbing your stomach, upper GI, and you break the bioavailability barrier. And that was the key to really making our detox systems work. And at the time, people were making liposomes, but really low grade. And I tried other people's, I tried having people make them for me. And I was like, yeah, these really aren't where it needs to be. And I got obsessed with how do you make the best liposome. And I succeeded in that. I had a one mentor here around Boulder and did that so well. We made a couple other things and, really broke through that bioavailability barrier that we had in integrative and functional medicine, and then started expanding on that until we're making liposomes and nanoemulsions. And we'll talk about the specifics of all these different particles, what kind of molecules go into them. But we expanded into doing that, and that really became our calling card. Even though we're known for detox in general as the main functional thing, we do cardiometabolic stuff, we do hormones, we do tons of longevity stuff, immune stuff, and Lyme things, and just spread out into that whole world until that became the dominant thing that we were doing. And so that was Quicksilver grew like that. We were originally just a professional supplement company, just doctors. Then we started doing consumer work, and that brought us into the biohacking world. And that's how we got here.
Okay, that's very interesting. I have a lot of questions about a lot of supplements and liposomal stuff. So, for example, let's start with glutathione. It's clear that the bioavailability of glutathione is not very good. Would you agree with that?
The peptidases in your stomach break those up. Same thing when we get over to talking about peptides. Certain peptides you can't absorb it all through your gut. Other ones you have moderate, these small couple amino acids, but you're breaking them down as they're going through there. And that's the thing with glutathione is your stomach is supposed to be able to break glutathione that comes through the bile tract down into its components, and then you reabsorb them. And so that was a big thing, is to protect the molecule from the digestive fluid and get it in as soon as you can before it breaks down. Glutathione was like the first, people always did vitamin C, but glutathione was the main one that really needed that bioavailability difference.
Okay, so if I look at just a random liposomal glutathione, what makes the random liposomal glutathione different from your liposomal glutathione?
Yeah, that was a big thing. And there was a time I took 5 liposomal glutathiones from the market, just different brands, and analyzed them all for one, their glutathione content, because the trick in making liposomal glutathione is protecting the glutathione, which is naturally not a very stable molecule. And so when it's in the water, it starts breaking down. And then eventually it forms hydrogen sulfide, that rotten egg smell. So most of these, you smell them and they smell god awful. And then people tell you, let's smell the glutathione. It's actually the ass-like smell of the breakdown products of the glutathione. And so one, you have to make the aqueous situation in there what's called low water activity. So the water won't break it down. So there's a way you blend different gums and sugar alcohols and alcohol in there. So you protect it. Then you have to keep it refrigerated. You got to keep it nitrogen blanketed when you make it. So one is protecting the glutathione. Two is having actual vesicles that we call liposome. And these are phosphatidylcholine spheres. And you have to make them a certain size so that they'll absorb right. And you have to use a high enough quality phospholipid so that they'll be stable. And so we get phosphatidylcholine, injectable grade phosphatidylcholine from a plant in Germany. They used to make the same stuff that was the injectable PC, the Lipostabil and Essential. It's hard to get now, but you can get it out of Russia. Same place making the same injectable grade phosphatidylcholine that goes in our products. And so you need super high quality phospholipids. You got to set up the system to break the liposomes down into this small size where they're transparent. That's less than 100 nanometers. And you need those to be stable for a long time. So a lot of people just use the word liposomal. Some people, they'll just stuff lecithin and vitamin C or lecithin and glutathione in a capsule, and then you eat it, and somehow like your stomach is going to reproduce this $2 million manufacturing line that I have and make these perfect liposomes in there. It's like a wish. And others, they're just getting like baking grade lecithin and they put it in this fancy blender and it'll look like kind of like a milkshake. And they say, oh yeah, those are liposomes. And that same study, we sent those out for electron micrographs to look at the vesicles in there. We couldn't even find them in most of them. It was just this mishmash of lecithin all emulsified up. Whereas ours are these perfect little spheres and you can measure them. You got laser sizers to measure them. We've used electron microscopy. So it's like you got to do everything on this pharmaceutical grade and with pharmaceutical grade ingredients. And you need all these controls. And every product that comes out, we have specific sizing control in our batch records. And it's just a lot of people are just using the word and then stuffing some crap ingredients in there and calling it a liposome.
That's very interesting. I didn't really fully understand. I thought, yeah, if it's called liposome, it's a liposome.
It's a liposome. It's like calling it a car. Is it a Yugo? You remember that old Yugoslavian car? Or is this a Maserati? No, it's just like everything. There's this huge variability, and you'll see that reflected in price often. But yeah, it's like
I see it in my industry. Yeah, my industry is DNA testing.
Yeah.
The gulf in DNA testing is unbelievable. It's like complete garbage, worthless garbage versus something that's like super useful.
Yeah. See, I didn't even know DNA testing was that stratified, but of course
you would not even believe it. It's unbelievable how stratified it is.
Oh, yeah. Some of these, when I analyzed these glutathiones, there was one that was 6% of label claim. All of it had broken down. Others were like 30, 40%. And I don't doubt that these people didn't put the glutathione in there, but it was all broken down already.
So let's think about the actual dosing of what somebody's actually going to get. Let's try to compare random glutathione that you buy on Amazon or whatever. You buy that, it's going to have what, on average, 20% glutathione in there, you think?
Yeah.
Of what they claim is in there.
Of the label claim will be glutathione. Some they're getting better, and some of them have that in there, but how much you get? In that study we did, none of them were any better than raw glutathione in what's called a CATCO2 absorption trial. So some of them were even worse. There's 20 to 50% of the glutathione that you think is in there. And then how much do you absorb? And these
So
people are
let's
doing like
take
500 milligram, 1,000 milligram doses. Like we do 100 to 200 milligram doses, and your blood glutathione will go up to the top of the range.
wow. Okay. So what you're saying is like a comparison. If we take 200 milligrams of your stuff, what is that going to compare to off the shelf glutathione?
1,000.
1,000 milligrams. So you
Yeah.
think that would be the equivalent?
Yeah. Yeah.
And you're
Yeah.
just,
Probably about a
I
5
guess
to
you're
1.
also just, you're stuffing yourself also with some oxidized, broken down
Yeah.
glutathione and
Yeah,
some,
exactly. It's
so
all these weird
less than,
breakdown products. They're all these weird sulfur chemicals.
you're going to have
It's,
smelly gas.
oh, yeah, it stinks. This stuff stinks.
Okay. What about taking NAC to increase
Yeah,
glutathione?
we've looked at that. And NAC is like when everything else is just banging in your life and you're healthy and everything's working in your biochemistry. NAC is a good way to keep your glutathione up. It's a precursor. It's the cysteine group in there is usually the rate limiting part for putting together the glutathione. And so that tends to keep you up. But as soon as you're sick or there's some damage to the body, what happens is the glutathione synthesis enzymes get damaged and downregulated. And then the NAC isn't enough to bring your levels up. And a lot of guys that tried this, reading blood levels with NAC, then they take the liposomal glutathione and boom, it goes right up there. So if you're compromised, you need the liposomal glutathione. If everything else is working great, you're probably good with NAC. And then maybe you need the liposomal glutathione if you get a little virus or you're a little sick, you're hungover, you've been traveling, you need that right in there. Then you need the liposome. And then if you're going into doing like a full-on detox, or some immune regulation, then again, you need the liposomal glutathione.
I see what you're saying. So NAC could technically work if everything's banging. What do you need to work? Let's say you have enough. NAC is, like you said, cysteine is usually the rate limiting factor. There's also glycine, and it's going to suck up glutamate as well, which we don't mind if that. Yeah,
glycine.
glutamate is probably the least likely to be the limiting factor.
Yeah, glycine could be, and some people NAC and glycine. People supplement glycine a lot there.
So if I'm taking a lot of glycine and NAC, and I take a lot of antioxidants, would that have a similar effect?
Yeah, it's probably it's a little.
The problem is that a lot of people,
you're directly putting this stuff in. You're going to turn the wheels when you do the liposome. But if you're just trying to keep that level up and everything else is going well in your life, then you're probably all right with the NAC.
Right.
I take more glutathione now than I used to because we made this new product called ergothione, where we have glutathione, vitamin C, selenium as methylcellulose, and then ergothioneine in it. And that is it's my favorite product right now. The ergothioneine goes in, and ergothioneine is this beautiful thing that, is real high in mushrooms. And you actually have transporters for it. So it's something you were designed to use. And it stays as this pool in. And when you have damage anywhere, it builds up in that area and turns up NRF2 and turns up all the antioxidant detoxification machinery and rebuilding machinery. And so ties together all your different antioxidant cycles. So I take it a lot more often now than I used to when it was just liposomal glutathione.
So I also take 10 milligrams of ergothioneine a day, or thiamine. Is that a good dosage?
Yeah, that's good. I do a little more. This is 20 milligrams in a teaspoon. And when I'm loading, sometimes I'll do 2 teaspoons twice a day or 1 twice a day.
Oh,
so
wow.
I'm 40 to 80. And that's not like vitamin C. You don't just piss it all out right away, build it up. But that 20 daily, if you're just doing a teaspoon a day, is freaking spectacular.
And how does it change with the liposomal? Because when I took the ergothioneine, basically what I did was, I always do mega dosing supplements, so I'll take a very large dosage. I liked how I felt from taking, I think I took 20 milligrams. I felt it. That was good. It was nice.
Oh, yeah. No,
what does the liposomal do to it?
It all goes on in at once. If you have any problem with your
Absorption.
transporters, everything goes in, and then you have all these different antioxidants working together. The C, the glutathione, the ergothioneine, and the selenium is key for glutathione peroxidase and thyroidoxin reductase. And so it's a way you link together every one of the antioxidant cycles and build them all up. Yeah, I should get you some of that so you can try megadosing that for a while.
Oh, that would be great. Yeah. So as I understand it, it's these liposomes and the glutathione. A lot of people have issues where certain enzymes are not working properly, and basically these things, they just go directly into the system.
Yeah.
If your absorption or enzymes are not working, you're still
Yeah.
going to get the effect.
Yeah. Yeah. They just shortcut all that. And one of the things when we did studies looking at absorption, we did some with CBD where we had 10 people take CBD just in hemp seed oil versus in what's called a nanoemulsion. And liposomes and nanoemulsions, if it's fat soluble, you do a nanoemulsion. There's an oil core in the middle. And if it's water soluble, you do a liposome. So we do nanoemulsions of CBD versus just in oil. And one, you had a much higher absorption in the nanoemulsion, about six-fold higher absorption. You had immediacy. It all peaked in the blood in 20, 25 minutes versus 2 hours. And then the big thing that showed the GI difference, the variation among these 10 people, like there was an average plus or minus 100%, plus or minus 150% through the GI. And then with the nanoemulsion, it was like plus or minus 20, 30%, the intra-individual variation. So the GI was just such a variable for people when it all had to be digested. But when it didn't, it wasn't a variable. Everybody had about the same blood level.
Wow. Okay. So yeah, that's quite interesting.
Yeah.
What else is very important to be liposomal? So I think if we're looking at the things that are most important, when you look at the supplement industry, you're like, okay, glutathione, if you're not getting liposomal, you're getting shit, right?
Yeah. Yeah.
Glutathione is probably not on that same level with glutathione.
No.
You can absorb that,
No,
right?
because you have
reasonably well.
transporters for it.
Yeah.
Vitamin C, it's not on that same need level. But then you get into these polyphenols, berberine, EGCG, quercetin. Our quercetin data, there was 25 times more absorption of the quercetin in the nanoemulsion than in the powder. And again, it all gets in right away. We have this product that, we first brought it out. We call it keto before 6. Like you could eat carbs at night, be keto all day. And it was all these things that are AMPK activators. Now we call it AMPK charge. We're also going to release it as GLP-1 activator because they're all GLPs.
Okay.
It was quercetin, resveratrol, berberine, silymarin, DIM, and a cinnamon extract. And all of those have really low native absorption.
Bioavailability.
And low bioavailability. And you're taking hundreds of milligrams to a gram to get anything. This supplement would put you into ketosis. If you had some sort of metabolic flexibility, you're pretty good at it. You can wake up in the morning, have a keto coffee, take this, and you're off to the races. You're making ketones. Doesn't matter what you had the night before. Now, the doses, 40 milligrams of all of those, except the berberine was 12 milligrams. That was enough to everything absorbs at once. All those different things are in those particles. They all get into the blood in 20 minutes. They all hit the cells and boom, you trigger this event and your AMPK activated and you can start making ketones right away. Those really have a massive bioavailability difference. And you see the absorption of those compounds. It's like quercetin's 5 hours to peak. But here we get it all in 20, 30 minutes. It's a totally different thing. So when you're trying to move the needle, maybe it's a cardiometabolic thing like AMPK activation. Maybe you're doing detox, you need NRF2 upregulation. It's that screaming high peak that moves the needle for it. So all of those phytonutrients, those phytocompounds really need that. There's a lot of things that happen in the GI signaling from there. But if you want cellular signaling, you need the particle.
Okay. And what do you think it's the same issue with liposomal? Because I've seen liposomal quercetin, I've seen liposomal berberine, I've seen liposomal, obviously, vitamin C, and what other? Yeah, I guess I don't know if I've seen liposomal milk thistle, but the idea is that they're selling liposomals. Yeah, liposomal resveratrol. How poor is the bioavailability for resveratrol?
It's not very good, and I didn't get blood uptake data on that, so I don't know exactly the difference, but it's going to be similar to quercetin. Well, there'll probably be a 10 to 30 fold increase in absorption. But the thing with those, people say liposomal, and then they'll just take phospholipids, put them in a blender with the actives, and hope that it goes in the liposome. But a liposome is water filled with a phospholipid bilayer on the outside. It's really for water soluble compounds. There's a membrane there that'll take some fat solubles, but the membrane's really small compared to the volume inside. So then you need to make what's called a nanoemulsion. So you've got like a lipid center, and that might be MCT oil. It might be various terpenes like limonene. And then you have to dissolve these non-water soluble components like resveratrol and silymarin and quercetin and berberine into a phase that gets inside that particle. And all these people that are saying they're doing that, they're not. You look at the ingredient structure, you get the product, you dilute it, you centrifuge it. This stuff's not even dissolved into the particle. And when all of our products are totally transparent. So if you can't have something non-dissolved in there and not see it. Theirs, it's this white milkshake-like stuff, and there's all this stuff in there, and you don't know if it's dissolved or not. And you bring it into the lab, you start measuring it, you're like, this stuff's not even in a particle. Or it'll be dissolved into these big fat chunks, and you dissolve them in water, you can see them just fall to the ground. It may help a little, but it's not true nanoparticle delivery.
I see. So it's not the same. Bottom line is that when somebody says liposomal, it could mean different things.
Nothing. There's no regulation on using the word, and the FTC isn't coming and saying, is this liposomal? A bunch of people told me I should put together like a trade organization, like the United States Liposomal Society, and have people submit their stuff and have it reviewed and say, yeah, you can use these terms. Or you can put this mark on your product and you're certified to have real liposomes. And there's more people on the scene now that are starting to do good work. But there was, for a while, it was just a lot of garbage. And actually the garbage has increased too, because liposomal this and that is like a huge thing these days. And so it is about time that we start stratifying and calling out who the good players are.
Right. No, that makes sense. What about some of these? I'm looking at some of the supplements on your site. So let's say, as far as I understood, you're also selling here vitamin D3 and K2 in a liposomal form, I assume. But
that's a great one.
That stuff gets, but that gets pretty well absorbed as it is, no?
No, there's real vast differences in the vitamin D, and you'll see it in the genes. I don't remember if it's VDR. I mean, that's more of a receptor one, but you have transporters for vitamin D, and they're all over the place. I've heard from so many people that are like, I couldn't get my D levels up. I couldn't get them up. And then I took yours, and boom, I was up at 70. I was stuck at this low level. And I've seen some people are ill. There was a kid with Crohn's, and boom, all of a sudden we got it up there. A lot of people just have gene snips who they can't absorb it well, and it gets right past there. And so that's in our top 3 sellers to this day because it works so well.
Oh, interesting. And K2 is the same situation, you think?
Yeah, it might be less inhibited in absorption because that's usually a food base for it. But this way they're coming together and you have that nice pairing of the K2 with the D coming in all at the same time.
What about the methyl B complex? What's the benefit of that being liposomal?
I think it's just getting everything in all at once. That's another one up in our top 5, and people swear by it because I feel so good on it. And again, there's probably variation in people's transporters for the B vitamins. Everybody has to have transporters for B vitamins or they wouldn't be vitamins. Like we saw with the CBD, there's so much variation in absorption. And you get to something like B12. There you need intrinsic factor from the stomach to combine with it, and then a transporter to take it in. So especially older people, they stop making an intrinsic factor, and this is like doing an injectable. It's like doing your B12 shot. So especially when people are having GI issues, you're getting past that absorption variability.
If someone does a measurement, a blood test, and they see their serum levels of B vitamins are high, their serum D3 is high, their serum K2 or vitamin K is high. Is there an extra benefit of liposomal? Meaning, is there an argument to say that it gets into the cells better, or once it's in the blood, it's in the blood?
There's an argument there, and it's something we got to get a little bit more clinical work on to show how it works and exactly how much benefit there is. But so the phospholipid membrane in these, they can fuse with the cell membrane and enable a much higher cellular delivery than you get without it. And blood-brain barrier crossing, you get a better movement into the brain. So there is a lot. It hasn't been totally worked out yet, but that whole fusion thing that's been known forever. There was a study on liposomal glutathione where this is really cool. So they did a cell culture study with neurons and depleted the glutathione in them. And then they saw how much just aqueous glutathione it took to get the levels back up in the cells, or liposomal glutathione to get the levels back up. So aqueous would be like doing an IV. The liposome was 100-fold more efficient at getting into the cell than just bathing the thing in glutathione. And you've got enzymes that have to take apart glutathione and put it back together inside the cell. And the liposome bypassed that and was that much more efficient. So even if your blood levels are high, how's your cellular level? How's the brain level? And there are arguments for bringing that in, especially again when you're pushing the system. You're going into an active detox, or you're just like a high performer guy and you really want everything running at its best. The liposome is going to get that cell level at the peak.
I guess what you're saying is that, yeah, your belief is that the liposomal is actually going to get into the cells, meaning it's going to be more relevant than just what's in your blood.
Yeah.
But that's something that hasn't been thoroughly studied.
And had been thoroughly figured out.
It's very hard to study that, though.
Yeah, no, it's these cell culture studies make that argument for you, but we'd have to do like biopsies and stuff. And analytical is getting better now. It was hard to measure all this stuff before, and so we'll see. But then you got to make a decision. What are we going to take? And if you start taking everything liposomal, it's like, how many products am I going to take? So you can look at your blood levels, all these things, and say, I got to focus on this and this, or I really want to bring these phytonutrients in. I know I need those in this delivery system. Sometimes you make a decision on which of the products you're going to use.
Got it. What about melatonin? Is that helpful if it's
because getting it across the blood-brain barrier is a trick. It's the melatonin, these nanoparticles. Yeah, it's a much more immediately registered brain thing, and at higher doses, it has a slightly trippy effect sometimes because it's able to get up into the brain and get all that signaling going, as opposed to just circulating up here out in the blood.
So these you're saying that the liposomal
it's 1, 2, 3 milligrams. It's not like 10, 20 milligrams.
Okay. And what about DHEA?
Oh, that's spectacular. The levels you get, we can take your DHEA levels up to 1,000 if you want, no problem. And so we do this. We have a whole female hormone line. You'll see core hormone support, DHEA plus, pure DHEA. These are all these DHEA nanoparticles. And in women, you're able to drive up your DHEA levels will go up a little super physiologic, and testosterone will go up top of the reference range, not 80, 90, 100, 120 by taking this nano DHEA. And what we see is they don't get all the androgen issues that you get when you take a capsule. So a capsule has to break down in the gut, all goes through first pass circulation. I think you get a lot of androgenic metabolites out, and then they get the acne, hair growth, or hair loss. We don't see any of that stuff when it just goes into the blood and does its normal circulation. And it can become other androgens very quickly. And we put some other stuff in there to control estrogen, some aromatase inhibitors. That's an interesting one. Chrysin capsule won't work at all because it gets sulfated in the stomach, and it's raw chrysin is an aromatase inhibitor, but chrysin sulfate is not. And so in the nanoparticle, the DHA with chrysin, you control and you don't make all this estrogen, but you do make testosterone. Now that's in women. In men, testosterone is hyper controlled, so DHA can't drive it. But DHA is a beautiful one in the delivery system. Pregnenolone, massive high levels, and then they ride for a long amount of time. We're actually, through compounding pharmacies, we're doing testosterone now. And so I do a nanoparticle sublingual testosterone. 12 milligrams will take your test up to 3,000. And then it'll coast down as you start moving it into different places and breaking it down. So hormones are huge. And then we do topicals. We make nanoparticle topicals of estradiol, estradiol, and progesterone. So the hormones is a place where the delivery system is totally a game changer.
Wow. What about the 17 alpha estradiol? Have you ever looked into that?
A 17 beta estradiol, like just
because the alpha one they studied that in mice in the ITP and longevity studies. They found that it increased longevity. It's a new one.
Oh, I'll check that out.
Yeah, I've been trying to get my hands on it, but nobody seems to make it. Yeah.
Yeah, probably not. The esoteric ones, nobody's making. I'll look in from one of the chemical distributors. I might be able to get a small amount and take a look at it.
The ITP, which they're doing these longevity studies on animals, they found two estrogens that increase longevity. One was the 17 alpha estradiol, and I could look at the other one, but it was another type of estrogen. They repeated that one with the 17 alpha estradiol.
Yeah, I'm writing that down.
It's just I like to do these supported interventions
Mm.
so it's 17 alpha estradiol, and what was the other estrogen that they did here? Oh, here it is.
Two,
Eh,
two
16
methoxy,
alpha hydroxy estradiol. That's the other one.
alpha, hydroxy.
Yeah, and they found that the longevity effects were only in men, the
Oh,
male mice. Yeah,
wow.
because apparently
I'm gonna
women are
look that up.
probably creating this stuff already. But
Yeah.
yeah, I just gave up on it because it seemed like it was going to be difficult to get it. But
Yeah, a lot of these things, they take a long time to make it out to the market. And it's a mouse study, then they have to look
yeah,
at
but
it.
they replicated this mouse study 3 times on the 17 alpha estradiol one.
Wow. Yeah.
Yeah,
No,
and
that's great. It's
these are
interesting when you
top
do
quality. Yeah,
when we did like absorption studies with the nanoserums of the estradiol. I did it to look at me and some women, and me, the estrogen goes up and looks normal and comes down. The women, it goes as they're turning in all these different metabolites and all these different variations. Women have a much more rich estrogen metabolome than men. And back to that, why the 17 alpha helped the men, not the women. Like I said, the women are probably making it already.
right. What about CoQ10 in a liposome? How important is that?
Yeah, there you're going to get to differences in absorption in the GI, and this gets past all of that. It feels great. One of the products of mine that I take all the time is the one that was my first, like everything mitochondrial supplement, and it's got PQQ and CoQ10, and then a big dose of phospholipids, some resveratrol, and a blend of adaptogens, and just fantastic thing. But that CoQ10 and the PQQ together in that immediate absorption, it really is great. And so again, there's people who have SNPs and absorption problems. With CoQ10, it's become so cheap. This is another thing. Like if the product's really expensive, then like the raw materials are really expensive, then you need that extra bioavailability difference. Now
Right.
CoQ10 is so cheap, you can take 300 milligrams and you're probably going to get enough in. But ours, you're taking 20, 30 milligrams and you're doing great. And another thing that's really nice, if you want this coordinated effect. So I talked about that keto product. Now you can take a capsule or resveratrol capsule, of course, and the berberine, all those things, and they're all going to absorb at different times. Some things absorb in 1 to 2 hours, some things 5 hours, something's 8 hours. If you want them all in together so they're coordinated in their activity, then you get them into the particle and everything absorbs at the same time. So the CoQ, the PQQ, the adaptogens, the PC, all there at once. That's where the delivery system really shines.
Interesting. Yeah, I think I think like you said, there's different people with different variants, and some people are going to absorb these things okay.
Yeah, yeah,
And then if it's cheap enough, also you could just take a lot of it,
yeah,
and some of it's going to get through. But you're going to have a bunch of things that are either just much harder to get into the system, or you want it in one shot, and
yeah,
you want it, or somebody might have some absorption problems, and then also getting into the cells.
yeah.
So these are the issues. What
Yeah,
about
and then
yeah,
having it all go in, you can set up like your routine with that. So when we do the detox, we do that push catch liver detox is what we call it. So you take this stuff called liver sauce, and it's got all these phytonutrients. It's got bitters for the bile flow. It's got NRF2 upregulators. All those roll in at once. So you take that, you jump in your sauna, and 20, 30 minutes later, you take your binders. So you're coordinating this stuff. So all this stuff's peaking in your blood while you're in their sauna, and all that's hitting you, and it's turning up all that activity, and then you binder. So push, sauna, catch. So there's all these different things. You can take stuff before ice baths. You can take stuff before workout. Take that nanotestosterone and go lift. You can really make all of your interventions max out for you.
that makes sense. Okay, so Let's see what else we got here. So tell me about detoxification, like people with mercury issues or detox problems. What are you typically seeing as the problem? Like how common are these issues and what do you do for them?
Yeah. See, it used to be everybody had some level of mercury toxicity because everybody had the old mercury amalgams, that mercury, silver, copper, zinc amalgam for the fillings. Now, a lot less people have that. So the people who have the mercury toxicity now tend to be real high fish eaters. And when you get high mercury levels, your main things are anxiety and fatigue. Anxiety because of the excess activity at the glutamate receptors. Now, that glutamate excess is also going to push you into neuroinflammation and some hyperinflammatory conditions. And the fatigue was from the action mostly on the mitochondria. It was very damaging to mitochondria, but it would also work on thyroid and adrenals. And so you would see those two things. Like when I worked on Tony Robbins, he was having not really anxiety, but he was having memory loss and fatigue issues. He had one of the highest mercury levels I ever measured at the time because he was eating tons of tuna and swordfish.
Where
So,
do how did you measure mercury? What kind of testing are you doing?
do this thing called mercury speciation. We do blood, hair, and urine, and we separate organic mercury that comes from fish from inorganic mercury that comes from your dental amalgams. Now, you make some breakdown of the organic in your blood. So you'll have these different levels of these two forms of mercury, and they go in different places in the body and they have slightly different effects. The inorganic blows out the kidneys more, it's got more joint effects and extracellular matrix breakdown, whereas the methylmercury is more neurologic, goes into the brain. So we look in the blood at the two different forms, and then we look at hair and urine as excretion indices. So the inorganic mercury goes through the kidneys, and you look at the urine versus the blood level of inorganic mercury, and it tells you how well the kidneys are filtering that out. So those transporters that move the mercury out can get damaged, and you build it up in your blood. It's called mercury retention. And then the hair is a surrogate for how well you're moving mercury glutathione conjugates out of your liver. And so how well is the glutathione system working? And so if the blood's high, but the hair's low, we know we have to work on the glutathione system. So how does mercury
Wait,
and
so if
its
the blood's high and the hair is low, it means that your
you're
tissues
not
are not
mobilizing it
absorbing?
right. You're not mobilizing it out right. Now, ideally, I would take a bile flow, bile mercury versus blood, because there's transporters in the liver that are moving it from the blood out into the bile, but we can't do bile stuff. So this is a reflection of how much glutathione conjugation you have of the methylmercury is how much ends up in your hair. And the blood to urine is a much more direct thing, how much are you getting all the way out. So you've got these two excretion indices and you got levels of the two, and then you put together your detox for it. So you need the way you get it out, it'll be bound to cysteine residues on thiols in the proteins in your cells or in the blood. And you have to get that conjugated to glutathione. So you got a mercury glutathione conjugate. So you need enough glutathione. You need activity of glutathione as transferase, which kind of picks the mercury off of the protein and onto the glutathione. And then you got the glutathione conjugate. Then that starts going out through the phase 3 transporters out of the cell into the blood, blood to liver, liver out into the bile, or blood to the kidneys and out to the urinary stream. So you need to get all those things going at once. And so the liposomal glutathione is getting in there. So we'll do this push catch, and we'll do it with extra glutathione. So you got glutathione going in, you got the liver.
The urine one is
two upregulators, and is turning up all the liver function. So you're moving the stuff out into the blood, to the liver, into the bile, and then you throw your binder in to pick it up 30 minutes later. And we have general environmental toxin binders, and we have a specific one for mercury called IMD. So once you do all that, you do the push with the glutathione, open up the liver. We'll usually take kidney support as well. And then you take your binder and you start bringing all the blood levels down. And you get all the stuff moving out of the tissues. So it takes a couple months to clean somebody up from glutathione, but we've been doing that since 2010.
Okay,
Clean
and
somebody up from mercury, but we've been doing that
yeah.
since 2010.
So when you're doing the urine test, that's a urine challenge one, right?
No.
Oh,
No, we
you
don't
just do
want a
regular
challenge
urine.
in this.
Okay.
Yeah. We want to see what the ratios are without a challenge. So when I came in with the testing, it was like a big sort of controversy because I said, you don't need challenge testing. You need better analytics. You need to be able to separate the different forms of mercury, and you need to be able to measure down in the part per trillion levels, because all that stuff's already in there. They used to say with the challenge testing, so you take the DMSA or the DMPS and you take mercury, you look at urinary metals before and after the chelator. And in everybody, the levels go up. And they used to say there's nothing in the urine until you challenge it and push it out of the cells and get it into the urine, and then it goes up. They just weren't measuring low enough. It's in everybody's urine according to what their body, in relationship to the body burden, unless there's some damage to the kidney. And then when you take the chelator, it goes up 10, 20 fold, but it goes up in everybody that much. And then they're looking at reference ranges that are based on non-chelated urine. There was a time at which that was the best testing that we had, 80s, 90s, 2000s, but now we have better testing. And so I don't want to perturb the system. I want to see what's going on. And now that I have inorganic mercury measurement in the blood, because methylmercury is much higher in the blood than inorganic mercury. So you couldn't get that blood inorganic mercury measurement to measure it against the urinary to know what your body burden of the inorganic is and what that transfer to the kidneys are. So this is a much more sophisticated way to look at it. The other one was hit it with a hammer and we see, all right, this person's got a lot, that person's got less. But now this is a much more sophisticated way to look at it.
What if somebody has low blood levels and just normal or low hair levels? Well,
hair levels.
Hair.
All right. Now they either don't have any high body burden of it. They just haven't been exposed and have that much. Or there is one situation where the tissue transporters are downregulated and the tissue levels are high, but the blood and urine are low. And the challenge doesn't get past that. The challenge tests don't go into the cell and push it out of the cell. That was the mythology around it. There was all this mythology around challenge testing. And they don't go into the cell. They don't get that out. They're taking stuff that's in the blood and lymph, a little bit of what's stuck in the kidneys, and pushing that out. So there was studies done, especially one in Sweden, where they saw that what came out in the challenge test was directly proportional to what was in the urine before. And this is one of the few ones where they did some advanced blood testing. It was proportional to what was in the blood in the inorganic mercury stores to begin with. And yeah, you can have a high tissue burden and not show it in the blood and urine, but there's no way to measure that right now. A lot of those issues, when people are really have a methylation issue, you'll see that. You'll see absolutely nothing in there. You give them methylation supplements and the levels will come up a little bit. Now, I never see it come like, whoa, Tony Robbins level from nothing, but you'll see it come up where it's easily measurable.
What about just taking DMSA? I've taken DMSA.
I did that myself. I got into this business and I didn't know I was going to end up doing all this detox supplementation. I thought I was just going to do the mercury measurements and have people do challenge tests with DMSA, and I would measure their urine. I'd say, this is how much inorganic versus methyl there is. I got all my amalgams out one shot and started loading all this DMSA, and my urine levels came up a little, but not that much. I kept taking more and more, and I got myself really sick because my kidney transport wasn't working well. So I was taking the DMSA, I was just moving it all around my body, and I wasn't getting it out to the kidneys. Now, fast forward, I know all these things. I have the kidney support, the glutathione support. Once you get all the drainage paths and the cellular paths and the NRF2 and the glutathione system working, you can put in some DMSA and speed up how fast everything comes in out of the system. But if you take a broken system, you try to force it with DMSA, you can make this people just a lot sicker. And that happened a ton. And so that was also, so I came and I'm like, you should test differently and you should detox differently. And there was about 10 years of me like fighting with the people who did all that stuff. And now we're past that. And that's the way things are done. And people may overlay the chelators on top of glutathione system and drainage detox setups like ours.
So you think that DMSA could work if somebody is dialed in, that has their detox systems dialed in? Okay.
Yeah.
Yeah. And you're saying with the kidneys, why do you think, I didn't quite catch why it was a problem with the kidneys that didn't work.
There's transporters that take glutathione conjugates from the blood into the urinary stream. And those same transporters work on the DMSA conjugates to get them into the urinary stream. So if we look at that, before you take any chelator, if I look at that urine to blood ratio for inorganic mercury, and I see high in the blood, low in the urine, I can then predict that if you take DMSA, you're not going to have a lot come out. In fact, there was one doctor I remember, he was telling me, oh yeah, here's my challenge test. It's really low. And I'm like, let's run all the other stuff. His blood levels were really freaking high in both methyl and inorganic mercury, but his urinary level was super low. So he had the detox going out through the liver. So everything will go through the liver, the bile, and into the GI. That was my whole thing in the beginning, because when you do DMSA, you're relying on kidney and you're dumping more metal into the kidney. And if you're not getting it through, you're going to toxify the kidney. So we moved them over and started getting everything out a different way. So you can have false negatives if you don't have that transfer between blood and kidney. And one of the things that damage those transport systems, endotoxemia, along with metal levels, damage that ability to get them out. There's old mouse studies where, if they gave them mercury alone, the urinary output was proportionate to what was in the body. And if they gave them mercury and endotoxin together, the urinary levels went down. For the same amount of mercury, and the urinary levels went down, but the body burden went up. So that whole transfer is a big deal, and it's necessary for the chelators too.
Okay, so as I understand it, you want to look at the ratio between blood and urine. If the blood is high and the urine is low, that means that the ability to transport from the blood to the urine to the kidney, the urinary system, is impaired. And so that's why you're just not urinating it out, right?
Yes.
Some aspect of that system of either you're not having enough. You could also not have maybe enough chelators to get it out, right?
Yeah, but that's not what we're talking about.
Maybe you don't have enough glutathione, for example.
Yeah, but you can also have enough glutathione, enough chelators, and not get it out. These are specific transporters that get damaged, and it's been measured. We know the mechanism in there. They're called MRP. There's two, OATP and MRP2, and both of those are strongly downregulated, especially with endotoxins. So there's a number of different toxins that will damage that. And when you have certain toxins along with endotoxemia, that transport gets damaged. So you need to repair them and rebuild them. The proteins, you can induce them and you can make more of them, especially if you're NRF2 upregulating. But when that happens, then we really want to focus on trying to get more of the toxin flow through the liver, bile, into the GI and bind it up. So these same transporters are in the liver and in the kidney. So we want to focus over, put more weight on the liver and repair them in the kidney. So we're going to build up glutathione. When we see that, we don't want to use any chelator yet. We want to build up the system and get all those drainage pathways working. There's different herbals we use for the kidneys, different nutrients, cycloestragonol and ferulic acid, along with some Chinese herbals, and build the glutathione. And then you start to see that urine to blood ratio come back up. And ideally, that's what you will see a lot of times, the mercury levels in the urine higher at the end of the detox than the beginning of the detox. Now, proportionally, you're going to see the blood levels go down. So that means that you fix the system and it's draining everything out. So we're looking at urine to blood before and after, and those ratios will change. And like I said, your urinary mercury levels higher now at the end than it was at the beginning. That means we fix things.
Okay. And then if we want to see the ratio between the blood and the hair.
Yeah, really getting glutathione in there pretty much fixes that pretty quickly. But we'll work on liver and glutathione at the same time, and you'll see those ratios change. And again, sometimes
I'm saying that ratio is going to be that is that going to signal how well your liver is detoxing?
Yeah, that's our surrogate there. It's not as direct as the other one, but that's what that's about, is fixing glutathione and liver cycle.
So where does somebody get these tests to measure how much is in the urine without
so that's called the Mercury test, and it's from Quicksilver Scientific. And there's certain states we sell direct to consumers called direct access testing, or you'll go through a functional medicine doctor to get it.
Okay. And that test, the try test, is looking at all three of them.
Yeah, blood, hair, and urine. That's why it's try test.
And that includes the analysis as well? Or is that up to the doctor?
That's up to the doctor. There's a pretty good description of how to read the testing. On the second page is all like, here are the ratios. This is what it means. And someone like yourself could read it and be like, okay, I got it.
And what are the chelators that you're using? You're not using in Quicksilver or DMSA, right?
No, we do it all based on upregulating the glutathione system. Now, some of my friends, Todd Lepine at Ultra Wellness, who works with Mark Hyman, and he'll do our stuff, and then he'll overlay a little DMPS. Some people overlay a little DMSA, but you can do it all just with our system. I remember Neil Nathan was a big mold guy. Now, he was doing mercury chelation with DMPS IV for 30 years, and he did this study of, it was like 8 or 10 people on our system and equal number on the IV chelation. And he said ours did as well or better than IV chelation at getting the levels down. But what you really see is people feel better much faster. You look at that old Cutler protocol, that was barbaric. They do DMSA. It was barbaric. Every 3 hours or you're going to die. And the guy was nuts. And you do that for 3 days and then 11 days off. And for the first 52 cycles, that's the first year, you're going to feel worse. And then you start feeling better. Like, you'll feel better in a couple of weeks on our system because you get the whole system working right. And you're not just going, mercury is the only problem here. If your mercury detox is broken, you have a ton of different toxins in there. You open all that up, you get the liver flowing, you get the binding in the GI, you get the urinary flowing, you get glutathione levels up. Everything gets better because while you're getting this stuff out, your cellular resistance is going back up. See, this is happening. Everything we're talking about on a whole body level, drainage, what we're talking about, the kidneys and the liver and getting it out of the blood, that's happening at a cell level. The cell has to dump things out. It's got little poop doors, these transporters that move mercury glutathione conjugates out. And if that's all broken, the cells build up with the levels and the glutathione levels are down in the cell and the toxins hit all the cellular stuff. When you have all that chemistry running and the cell becomes resistant to the metals that it has, and it's getting them out at the same time. They've done these cell culture studies where you can bring up the levels in the cell culture. They'll find cells that are resistant to the metals in the cell culture, and nothing's going anywhere. All the metals are in there, and the cells are humming along. They're doing fine. And they find they have a lot of glutathione. They have a lot of glutathione that's transferase, the linking stuff, and their transporters work really well because each cell has a transporter. And so those guys are fine. And there's mercury and cadmium all around. They're fine. If you slow down any of those reactions, you slow down glutathione synthesis, the conjugation reaction, the transporters, the cells die. They lose their resistance. So when you do this right, you make your cells resistant to the toxin at the same time you're flushing it out of the system. Versus this idea that just put the chelator in and get it out of the blood and everything else will get better. That's why it takes you a year to start feeling better.
What about I take a lot of things that are chelators, but I think my system is working well. I don't feel bad from them. What is that?
What do you take that you think is a chelator?
I take, let's say, lipoic acid.
Yeah, that's not a chelator. And I've gone through all these arguments with these people. You got to go and you got to read all the papers. You got to know the glutathione chemistry. It's the famous Gregis paper. You see, lipoic acid is an NRF2 upregulator. It turns up your own chelation system. Now, that on its own, the reason people would get into trouble just taking that is it makes the cells dump the mercury out of the cells into the blood. And if you don't have the liver and kidney function going, you just start circulating it around. So that was true, but they thought it was because it was an intracellular chelate. No, DMSA will go and take stuff out of the blood and through the kidney, say that's all working, but it won't go into the cell. You need to turn up NRF2 in the cell, which is the trigger to turn up all that intracellular glutathione-based mercury chelation and dump things out of the cell. That was why in the Cutler protocol, you start with DMSA and then you add in the lipoic acid. Now, he misunderstood it and he thought the lipoic was going and chelating everything. The lipoic was turning up your intracellular natural chelation system and dumping stuff into the blood. So the correct thing of that is let's lower the blood levels, then let's get the intracellular stuff to dump out. And we'll keep going with this DMSA thing. So we use lipoic all the time. And in the beginning, if somebody's sick, we won't use lipoic. We'll use the drainage system, the kidney drainage, liver drainage, binding. We'll use vitamin C, and we'll start getting that drainage system going because I don't want to squeeze from the cells into the blood. And then when we got them a little stabilized, then we put the lipoic acid in. And then you'll see this stuff come out. In the beginning, we would measure something when we got people to really high detox levels. We're really cranking on NRF2, high lipoic levels. You'll actually see, if you say you're doing like a 10-day run and then you're going to take 4 days off, you'll see the blood levels in some people actually go up. So say your level's at 8, I'm just going to make a number up here. And then 8 days into this, your blood level might be 10 or 12. And then you go off of it for 4 days and it drops down to 3 or 4. So you're squeezing the tissues and you're getting the stuff into the blood, and then you need the drainage system to keep up with it. So lipoic acid is a great detox stimulator at a cellular level.
Got it. I see what you're saying. So anything that's going to upregulate NRF2, which is a lot of plant materials, right? A lot of plant compounds.
Some are better than others.
Right.
Everything has
Which one's the best one in your opinion?
Lipoic is my favorite.
Okay.
A little stronger.
Does it need to be liposomal?
It doesn't. If you do like sodium R-lipoate, you get pretty good absorption of that. We did some blood studies years ago with just alpha lipoic versus the liposome. There was a much better absorption with the liposome. But here, if you're going to take it, you've got it with all these things that upregulate the bile flow and other things that upregulate NRF2 with it. Then you want it going in with the liposome so everything hits at the same time.
Got it. What about, so would you recommend taking a bunch of NRF2 upregulators
the other one, sulforaphane, is a really strong NRF2 upregulator, but needs to be delivered. You need, because it comes as glucoraphanin and it needs myrosinase with it. So there's some people doing that now, but it's also the most cytotoxic.
Do you sell the sulforaphane?
No, I don't. We haven't gotten into that one because I like lipoic acid better because, one, it's a mitochondrial stimulator. Two, it hits PGC1 alpha. It's good AMPK upregulator, and it's a little less toxic. Sulforaphane is more toxic to the cells. Now, that's why it's an NRF2 upregulator. Arsenic and mercury are NRF2 upregulators, but they have a lot of collateral damage that comes with it. So you want something that has other good benefits for you, because these are microformitic reactions. You think that these things like green tea extract, you think that's an antioxidant? No, it's actually a pro-oxidant. It makes little free radical reactions and gets NRF2 to upregulate. So you want it to do that in a pretty mild way. And sulforaphane's a little bit more aggressive. And people who have sulfur allergies and sulfur sensitivities have a harder time with the sulforaphane. And you don't see that as much with the lipoic acid. So that's the way that I use them. I make sure drainage is good. Then I get the NRF2 upregulated at the same time we're upregulating bile flow. Because we didn't talk about that, but how do you get toxins out of your liver? Goes with the bile. So the bile transporters and the toxin transporters are the same thing. So when you detox, you have to couple it to bile flow. So you're turning up NRF2, dumping into the blood. You need the reactions. There's transporters pulling it from the blood into the liver and dumping it into the bile. So you need to upregulate bile flow at the same time you're moving.
How do you upregulate bile flow?
Traditional bitters. It's really pretty easy. Things like gentian and myrrh. So in our liver sauce, there's all those different bitters are in there. Now we have the bitters independent. We have bitters number 9 and bitters X. Bitter X, a little bit more bile flow. Bitters number 9 has bile flow and some stomach upregulation, digestive. So these traditional bitters, let's look at Angostura bitters. This is a great tangent. That, the stuff you put in your old fashioned, that was developed by a surgeon for the U.S. Army who was stationed in the Caribbean. And he had to have one thing to keep his whole regiment healthy. And he developed Angostura bitters. The one way to have all these soldiers with all their different shit be the healthiest was to give them bitters. So they'd have digestion and detoxification all working. And that was the best thing he could do. So that's just a wonderful, simple trick. And we use a lot of bitters independently. Anytime you're itching or you have digestive complaints, that's failure to get bile flow going. And there's so many things that can stick that. And so when you're taking say you're taking all this lipoic acid, but you've got some sort of problem bothering your liver drainage, you're just going to move all that stuff around. So when you do this push catch, you got the bitters in there, you got the NRF2 upregulators in there, you got mast cell stabilizers in there. You're able to catalyze the movement from the tissue to the blood to the liver out into the bile tree and into the GI. And because that all peaks in 20, 30 minutes, half hour later, you take your binders, catch it all up, you tie that whole detox cycle into a nice little bow, and you're done. And then you can do that once a day. You can do it twice a day. You can do it 3 times if you're really going at it. You can do half doses, double doses, triple doses. When you do it all like that, you don't run into these problems that people get into with detox, why they're so afraid to detox.
What about just taking activated charcoal, for example? Activated charcoal is a bile acid sequestrant, right? And if you're going to sequester the bile, you're also going to produce more of it, probably.
The toxins that are coming out with the bile.
So is that something, I feel like that's something that would be very good if you have toxins in your bile.
Yeah, charcoal's great. We have something called Ultra Binder, which is a much more sophisticated platform for binding. And that's got the activated carbon. It's got some zeolites, a little bit of a bentonite. When zeolites and bentonite really do the same thing. And then it's got chitosan, which is a real good mold toxin, a biotoxin sequestrant. It's got the IMD, the metal binder in there. And so you have all this different chemistry of toxins. And they all have a certain specificity. They all like a certain binder, one binder over the other binder. So you've got a bunch of different kind of binders in there all at once. That gets the most different things. And then we have some acacia.
What is this product called?
Called Ultra Binder. So if you do our liver detox,
that's from Quicksilver Scientific?
Yeah, liver sauce and Ultra Binder. So just activated carbon is great, but Ultra Binder has all the different binders in there and some GI things to soothe the GI. And so that's push catch. Move all the toxins, they dump out with the bile, and then you take your binder and pick it all up. But the simplest binder of them all is activated carbon. And there was
what about
the Russian Institute of Gerontology, the bioregulator, peptides, and cavacin.
Yeah.
That came out of the Russian Institute of Gerontology. Great freaking place. They did a study back in the 80s with mice. They aged them out till they were like a 40, 50-year-old person. And then one group of mice they give charcoal to, and the other group they didn't. The ones with charcoal lived 30 to 40% longer than the mice that they didn't give charcoal to. And they looked inside at what was going on, and the lysosomal activity was totally different, meaning autophagy was upregulated in the charcoal supplemented rats. And that led to them living longer, just this pass-through supplement of this toxin binder. And they talked about having a third organ of detoxification, and that kept we make so many metabolic toxins, and that kept all those toxins down and turned up autophagy.
Does zeolite need to be in a liposome?
No, crazy for doing that shit. And there's nano zeolite where they dissolve this shit out in sulfuric acid until it's at this nano size, so it gets into the blood. Yeah, that does something to you. But when they're not, they sell you this story like it's some smart little piece of glass. It's a little piece of glass. And like it's smart, and it goes in, and it knows the toxin's there, and it zaps it, and it grabs it, and it takes it out all on its own because it's got this supreme consciousness of the divine zeolite. Like bullshit. You want that in your gut doing what it does is an adsorber. It adsorbs really nice, and those honeycomb structures take the toxins in there and move through. Now, it's not that nano stuff doesn't do anything, but it's a hormetic toxin to your body, and it freaks out your immune system because you got shards of glass going through it, and that upregulates some activity, and then you need macrophages to come eat the stuff and get it out of there. And they were doing nanozeolite studies on dogs with cancer, and they're able to cure that, like in Russia. That's not what they tell you is happening, is not what's happening. And so you want shards of glass in your blood to freak out your immune system and turn some shit up. You can do that, but I'm not going to do that in my detox.
That makes sense. Okay. Yeah, this has been very helpful in understanding a bunch of stuff.
Yeah, once you get all the way in there, it's like, holy shit, that's how it works.
Yeah, I'll tell you something. There's a lot of bullshit in this whole detox space. Right?
Oh, God, it's terrible.
So when you're out of it, you're just like, oh, there's a lot of bullshit going on. You're like, maybe I'm gonna try to sift through the bullshit, the garbage here, try to find some and you just don't know where you're just like, oh, this person says this and this person says that. And you're just like,
Yeah.
how do I know what's going on? But it sounds like you really know what you're talking about here.
No, we're all the way in on these are all the biochemical reactions. These are all the macro reactions. This is how it all works. Remember my PhD was mercury chemistry. And
Right.
so I knew all that stuff when I came into the integrative and functional medicine space. I'm like, you guys don't even know how to think about this. So it really changed the way that we look at stuff. And you know what? I'll send you a detox system. You just go through it, see what it feels like.
Oh, I'll mega dose that shit.
What's that?
I'll mega dose that shit.
Totally. Yeah. 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 And it's like, it shocks you because it's like, oh my God, it feels fucking great.
That's
If you're
amazing.
like hypertoxic and you megadose, you want to titrate up. But if you're pretty clean, you can do to the megadose ones, and it's holy shit.
Yeah, I'm pretty clean because I've been doing, I take 170 supplements a day. So just all these supplements.
Yeah, no, you'll be able to go into like double, triple doses twice a day, and you'll feel it. It'll feel good.
Yeah, like like a lot of things that people say would destroy them. I can take DMSA, I could take EDTA, combine them, take a whole bunch of chelators. I'll be fine.
Yep.
I take
Yeah.
5 grams, sometimes even 10 grams of activated charcoal. I'm fine.
Yeah. Yeah.
It's
No,
like,
you
but
do
some
it all
people are
together,
like, oh,
organized like this, and yeah, I'll give you you have a liposomal EDTA, and you totally need a liposome for EDTA because you don't absorb that at all. It's more like a
I do the rectal one. Yeah, the
well,
rectal one has good
I'll give you an
absorption.
oral option. Be an oral guy or a rectal guy. I'll give you the oral option. Works great, goes right into the brain. We use a ton of that.
I love the oral option, actually. It just, I couldn't find it. But now that I know that you have it.
Oh, yeah. No, it's fantastic.
This is great. I think there's gaps in the market, which I think you're filling with a lot of products that are not so easy to get in. And that sometimes you don't need that much of it. And if you take the right form, you can really do some good stuff.
Yeah. And now we're doing the whole peptide thing now. We already have the copper GHK out. We have BPC 157 with KPV and with TP 500 coming, then epitalin and thymolin, all in nanoliposome. Copper's already out. The others are going to come out in the next couple of weeks.
What about, do these things need, I guess do these things need the liposomes?
Oh, yeah, totally. We were able to do GLP-1s, and the GLP-1s, they talk about size. So these smaller, more bioregulator ones, like KPV is like 3 amino acids. GHK is 3 amino acids bound to a copper. They have a better shot at going in, but just like glutathione, the peptidases can break them down. And so, yeah, you can get some in orally, but a liposome, you're going to get way, way more. Then you get the bigger ones where you're not 3-4 amino acids. BPC, they do oral because a lot of it is used in the GI. I mean, it was first isolated from gastric acid, but that's a larger, I don't remember how many amino acids that one is. It might be 40, or maybe the TP frag's 40. And then you get to the GLPs, and those are much larger. You're never going to get those all the way in, but we were able to do GLPs orally and get the same effects. Not using, you might have to use 5, 7, 10 times more, but you get it in with a liposome. If you're just doing a capsule of a GLP, you might have to take 100 times more than an injectable just to get the relevant amount out. So the larger it is, the more it absolutely needs a liposome, but the smaller ones are going to get so much more in.
My last question, this is a popular thing these days, is microplastics. What's your recommendation on detoxing microplastics in the blood?
Yeah, that's a rough one, and we're trying to look at it, and there's not a whole lot of data there. You're going to need some combination of immune and chemical detox. If it's a larger piece, you need a macrophage to go eat it, so you need a robust.
Would activated charcoal do it?
It's not going to get so when you do when we do detox, we want something pushing out of the body, and then you need a passive grabber in the GI. So activated charcoal will get something that's coming through the GI and prevent you from absorbing it, but it's not going to get into your brain and get anything. So you need to get your system to push it out where the charcoal can get it. And so it's got to be some combination of good immune activity for the larger microplastics, which you can't chemically break down, and good detox activity for the smaller ones. You might be able to get your detox system to conjugate them and bring them out. So we're trying to figure out the whole microplastic thing. That's a big irritant on the system. It'll bring up a lot of low grade inflammation in the system. And it's a real problem. And we're trying to figure it out the best we can.
What's your opinion on plasma exchange, like plasmapheresis,
Yeah, I haven't done it.
as a detox?
I think plasma exchange is great. And some of my friends that are doing it, David Hassey does it in the Maxwell Clinic in Nashville. Paul Savage is somewhere in the Midwest, and he does that. And the data they've shown, you can really bring levels down pretty quickly with a couple plasma exchanges. And so I do believe in plasma exchange, plasmapheresis. I think the exchange is probably the best. Just throw the shit away and put new albumin.
Right.
But I haven't gone and done it yet. That's on my list for this year.
All right, awesome. It was a pleasure chatting. We've chatted before, but always in a light way.
Yeah,
Never
this
about
is much
serious
deeper.
subjects.
Yes, or social.
Exactly. Oh, but it's interesting. I didn't realize you knew so much about this stuff.
That's my job.
No, I heard you knew a lot about it. So your
Yeah.
reputation was you knew a lot about this stuff. It's just like I didn't know on a first-hand basis.
Yeah, I see it, health optimization stuff. We're both busy. You probably didn't see my
Right.
talk. You're out there doing your thing. But now you know.
Now I know. All right. So where can people find this stuff? Like where can they buy your stuff
Yeah,
and
QuicksilverScientific.com. We sell direct to consumer, get an account there. You can find us. We have an Amazon seller too that has these things. If you want to do more specific stuff, you got to do line work and detox with it, get a functional or integrative medical doctor to do it with. And there's some products that we don't sell to consumers and they're only doctor access. I think you see us on Instagram, Quicksilver Scientific. There's Dr. Christopher Shade is another Instagram feed that has our stuff, but we're pretty easy to find. Just Google us, come to the
Awesome.
site.
Yeah.
And if you're a doctor, get an account because there's so much education inside the site that you need to log in to get to. And then there's 40 or 50 webinars in there. There's tons of education. We're really rich on that.
Wow. Okay. Awesome. Thanks for coming on. I really appreciate it.
All right. Thanks, Joe.
All right. 67% of listeners aren't subscribed to the show, so please don't forget to show your support by hitting the subscribe button now. You'll not only be supporting the show, but also investing in yourself and your health journey, all while helping keep us ad-free.